Welcome to another episode of Clinic Success Secrets, the podcast where we uncover the strategies and insights that drive clinic growth and elevate patient care. I'm your host, Tomás O'Dwyer, founder of Clinic Success Partners, a medical digital marketing and automations agency dedicated to helping clinics serve more patients and achieve the success that they deserve. Today, it is my absolute honor to be joined by the one and only Brianna Socci, a visionary entrepreneur and co-founder of UberDoc, a very interesting business that you're going to hear all about over the next hour or so. Her expertise in healthcare innovation, patient access, and entrepreneurship has positioned her as a true trailblazer in rethinking how care is delivered and accessed. In this episode, we'll be diving straight into Brianna's journey, her innovative ideas, and her perspectives on shaping the future of healthcare. Brianna, it's an absolute pleasure to have you here.
Thank you so much for having me. I appreciate the introduction.
No, as I said, innovative entrepreneur, no, for sure. Before we get into what you do today, I'd love for anyone that's listening here to hear a bit about your own backstory, how you got into where you are today.
Yeah. Before we launched UberDoc about a decade ago almost now. So it's hard to envision what I was doing before this. I went to business school. I come from a marketing and advertising background. Worked in a bunch of different industries. I've always been super entrepreneurial. I was always launching different businesses. I was a little kid. I loved, buying things and then reselling them. I kind of just loved that, like that hustle and that grind. When my co-founder is a surgeon here in the Boston area, and when she approached me, with some of the complexity she was dealing with in our office and the idea of wanting to launch a platform like UberDoc, it was a no-brainer for me to leave the corporate life and dive into entrepreneurship.
Love it. So UberDoc itself, tell us a bit about the mission and what you guys are set out to do.
Sure. So at UberDoc, we're transforming the way patients access healthcare by offering direct, immediate access to top doctors for a flat, transparent fee. So our platform bypasses the complexities of insurance and long wait times, and it connects patients with specialists in as little as 24 hours versus the U.S. national average of about 26 days right now. It's sitting at for a doctor's appointment. Our soonest appointments are within 12 hours, but most patients access within about 24 to 48 hours on our platform. And I got into this because I saw firsthand the frustration and delays people experience in getting the care they need, which is often coupled with high costs and endless red tape. No matter where you are, someone has a story about when they tried to access the healthcare system and it just didn't work with them, or it didn't work for them. So at UberDoc, we aim to make healthcare simpler, faster, and more affordable, ensuring that patients are in control of their healthcare journey. And we're on a mission to democratize access to healthcare.
I love it. I mean, it's so noble, but it's also so important. I had the pleasure of interviewing someone else yesterday. Her name's Nirmal Kaur, a business called Sincoro Health, and many ways up the same mountain. I find it so fascinating seeing all of the different strategies that people approach, because it's clearly a really, really pressing issue. I think she was telling me, for example, that apparently, I'm going to butcher this, so for anyone listening, please refer to the podcast because she had the actual stat, but I believe it was 38%. I think 38% of hospitals in rural areas, they're set to potentially close across the US. And she was talking about just how incredibly difficult it is to actually get this access, and especially the difficulty of things like telehealth and all that. It's a real crisis. So I love that you're doing something about this. Could you share a bit more about the model and what it actually looks at, sort of behind the scenes for both the practitioners and the patients, please?
Yeah, absolutely. And just to add on what you were just saying, it's a huge issue right now and crisis, just like you said, for hospitals that are shutting down. And a lot of that is just due to, I mean, one, access points, right? Especially if you're a rural hospital, those access points are hard. But like, it's just so hard to collect money from insurance, right?
Yeah.
A physician or a hospital does a service and they wait 30, 60, 90 plus days to get paid for that, right? And they've already, done the service and just waiting for that cash flow. So many clinics, whether it's a hospital or a private practice, they're shutting down because it's just a cash flow problem.
Yeah.
So it's really difficult to see something like that. Um, and yeah, so our platform is really simple. So at the end of the day, UberDoc is an appointment maker and it's a payment processor. So we have a two-sided marketplace. We have physicians on one side, and then we have patients who book appointments with them on the other. For us, it was always, we initially launched UberDoc. It was like the chicken or the egg. Like, what do you do first, right? You need to build both
Yeah.
these things. And it was like, who do you get first? And what we noticed is it was really difficult to like we went in, doing a lot of direct to consumer initiatives, got lots of, patients coming to the site, super interested, but then they were like, you have no doctors like near me, so I can't book an appointment. So we were like, okay, we're going to go out and we're just going to get all the doctors. We're going to partner with every single doctor, in the area. So, we started in Massachusetts because that's where we are. And then we just kind of grew and grew. I literally knocked on every doctor's door and asked them to be on the platform. But in order to get them, we had to make the barrier to entry real, minimal, right? It had to be really low. So it's free for our doctors to join, and it's still free for our doctors to join because we want, every doctor in the US to be part of this. So doctors join for free and they list priority appointment slots on the directory for a patient who wants to pay cash and go direct. So most of our doctors list somewhere between 1 or 5 weekly appointment slots. Some right at the beginning of the day, at lunch, maybe end of the day. And that just appears in perpetuity. So we have lots of doctors who are like, okay, every single Monday at 8 a.m. I have an UberDoc slot. And they're incentivized to do this. One of the questions we always get is, well, access is low because doctors are so busy, right? Well, yes, right. But every doctor has a no-show, rate. And there is capacity in a doctor's office to be leveraged. The issue, a lot of the delays where they're caused is from insurance, right? There are so many steps that a doctor's office needs to go through just to guarantee that they're going to get paid something for that appointment, right? They have to call their front end has to call insurance. They have to get the referral. They have to do all the paperwork. And that takes weeks, which is why it takes so long to get a doctor's appointment, which is why with our platform, because it's cash, there's no insurance, you can walk in tomorrow because you're just paying directly for that service. So like I said, we have doctors on one end. We've got about 5,000 doctors nationwide and over 55 specialties who participate. And then, they list their priority appointment slots, and then a patient can go on our platform and choose the appointment that works for them and pay directly on our platform.
I love that so much. So again, to clarify, this is purely cash-based practices that you're working with uh, in this case.
So they're not all cash based. I mean, we do have some like direct primary care providers who participate, but actually most of our doctors take insurance. They're just your typical private practice doctor. But what they're doing is they're offering these appointments, right? We always
Mhm.
say like we're similar to like the cash pay line at the grocery store. So they have insurance patients who are in their waiting room, but then they also have this access point for someone who just wants to pay cash and go direct. The other thing too is most of our patients have insurance, right? In the US, in almost all states, you need to have insurance. So our consumers are just choosing to pay cash for this initial consult to just skip the line and go directly. But then if they need a procedure, they need an X-ray, whatever, then they can use their insurance. They're just getting that first appointment quicker with us.
I love that so much. And again, complete tangential now. I love the direct primary care model. I think
Sure.
from the practitioner side of things, it's just it. I've heard so many great stories of practitioners' lifestyles, even just being
Yeah.
and business being changed up completely between the relationship with the patients, the cash flow issues, as we mentioned. And I love the fact you're making everything more accessible to everyone. Uh, and these are primarily telehealth, obviously, appointments. You're not navigating in-person appointments or How does that work?
Yep. Sure. So we are both in-person and telemedicine. We actually launched with in-person appointments first. So we're not, a telemedicine company.
Wow.
Actually, we launched with 6 core surgical specialties, including orthopedics, gynecology, urology, general surgery, ENT, et cetera. And
Mm,
those specialists, like the utility of telehealth, and this was pre-COVID. The utility of telehealth didn't really exist yet, right? Because
yeah.
our orthopedics were like, I could see someone, I guess, over video conferencing, but like I can't really touch their knee, right? That way. So we launched offering in-person appointments. And then actually pre-COVID, we had some direct primary care as well as behavioral health physicians who came to us and said, "Hey, we're kind of transforming our accessibility and we're offering telehealth appointments for psychiatry and psychology appointments. Could we be part of your platform?" And we were like, "Yeah, I don't see why not." Behavioral health was really the catalyst behind that, and behavioral health is really large on our platform. 25% of our annual appointments are behavioral health appointments. So we do offer both in person and telemedicine. It's a doctor's discretion what they offer.
I love that. And obviously, we're at this sort of inflection point, I think, in healthcare where people are getting used to more and more telemedicine. And again, COVID was obviously the catalyst for all of this. That being said, and correct me if I'm wrong, I would assume that there's occasionally a bit of pushback, may not be the word on the patient side of things, but how do you go about overcoming and educating patients, about the whole concept of logging into a platform, navigating this and so on?
Yeah, that's a great question. When we first launched UberDoc, we thought that this was going to be a great model for someone who had the extra cash, right? Who had the discretionary income to skip the line and go direct, right? It was kind of like a VIP thing. But then what we soon realized is, in the US, about 90% of the US workforce do not meet their deductible in one calendar year, which means that they're always going to pay cash for care, right? There was kind of this concept that like, oh, I have insurance, I pay a premium, insurance just covers my healthcare. But now we realize, no, every single time I go to the doctors or every time I pick up a prescription, I take out my credit card and I pay something. Um, so I think people are they're getting there's a lot of fatigue over the idea that you're paying for this healthcare premium, but then you're also still paying out of pocket for costs. So as deductibles have gone up and the out of pocket expense has gone up, what we've realized is people are choosing to use UberDoc because they know what the price is before they walk in, and it's fixed, right? Um, and it's typically cheaper. So,
Yeah.
so a lot of our doctors, like they set their price, right? Physicians on our platform set their price, but a lot of them are savvy enough to say, "Hey, this patient's paying cash or out of pocket for it. I'm going to make it a little cheaper than what I would get from a traditional insurance product because that's going to incentivize the consumer to want to use UberDoc." And that's great for the physician because the physician's saving the cost on all the administrative burden, right? Their front end's not calling insurance, they're not calling to collect payment or anything. It all happens on our platform. So it's taken some time, right? We spent, we at the beginning of this, especially because we launched direct to consumer, and we still do a lot of direct to consumer initiatives. There really is that education piece, right? Teaching people that like UberDoc's cheaper, but again, as time's gone on, consumers are starting to realize that themselves.
Nice. I, I love that. And with regards to I mean, what I'd love to hear if you have any, if there are any success stories or bits of really specific feedback that you've had from patients or providers, that as the founder really has reaffirmed, okay, you know what, we're doing the right thing. Are there any case studies or bits of feedback that come to mind that really made you realize, wow, we're making a big difference here?
Yeah, at least on our doctor side, a lot of the doctors that we partner with are solo private practice docs, right? There's a big trend here, at least in the US for consolidation. Providers are selling their practices off to larger groups or selling to the hospital and things like that because it's just so difficult to run a private practice right now. Similarly to what we talked about earlier about just that cash flow. It's hard to run a practice. There's lots of overhead costs. So, what's been awesome is our mission on our provider side is that we help them increase revenue and attract new patients into their practice, right? For them, we're kind of like a marketing tool, right? It's a new way it's a way for them to be listed on the internet. It's a new way for patients to find them. And again, they get that cash immediately into their practices. So what's really awesome is a lot of our doctors come to us and tell us like, hey, like, I made $15,000 last quarter partnering with UberDoc, right? Like that pays, that helps pay my front end. That helps pay, the PA in my office, right? I'm able to keep the lights on and I can stay in practice because of this partnership I have with you and because, I had access to all these new patients and appointments. And I get paid directly for them. So that's really awesome is, the doctors who are able to stay in practice because of the partnership that we have with them.
I love that. Then, I mean, obviously on the patient side. So obviously, for doctors, they get the opportunity to sign up for free, as you said, I believe. And
Mhm.
again, side note, and by the way, Brianna has not asked me to say this. I'm explicitly saying this. I can't see it. Is there any downside? I mean, I can't see any downside for why someone just wouldn't sign up. To me, it seems like a no-brainer.
Yeah, no,
That's
absolutely. And
naively,
that's
or
really that was the plan, right? It's like we really wanted it to be a no-brainer. And the reason why is we just wanted to have all the doctors part of our network. So we literally eliminated all barrier to entry. Yeah, for doctors, it's like it doesn't cost you anything. So like there's no problem not to there's no reason not
yeah,
to sign up. I think sometimes where the complexity enters is sometimes with larger groups, right? Like hospital-based groups and things like that. It's hard it's just hard to get someone to do, to create the profiles or to figure out like who gets paid, right? Does the doctor directly get paid for the service or, does their institution get paid and things like that? I think we just end up, anybody who doesn't join, it's really, we're just hitting against, priorities that a medical office has and having someone, get all 26 of their doctors on can be hard sometimes. Which is really why we partner with those private practice docs. They end up
mm,
being, good partners for us.
it's easier, less, yeah, less moving parts, the operation complexities.
Yes.
Yeah, the communication
Yeah.
overhead's not
The
the
sa-
same.
yeah, the sales cycle's a lot quicker.
Yeah, so
Or- yeah.
more agile. Obviously, there's, as with any marketplace, as you said, it's often it's a bit of a chicken or the egg situation. You got to really balance that supply demand in terms of the
Yeah.
providers and so on. And I definitely would in a minute love to ask about how you've acquired new people on the patient side of things. But before we get there, building and scaling, like I said, marketplace, not easy. What were some of the biggest
Yeah.
challenges that you encountered, and what solutions did you come up with along the way when it came to building UberDoc?
Yeah, that's a great question. I think, the biggest challenge that we faced was so both my co-founder and I were both not only female founders, but we're both first time founders. So one of the biggest challenges we faced was access to funding. There's lots of statistics out there about the discrepancy and funding specifically for female founders. Um, so that's always been hard for us. You want to scale the platform, but you need funds to do it. And this was before, we had customers to be paying us, right? And I think the other thing is we scaled really fast. So we went like nationwide really quickly. I always say like if we could do it over again, I would have just built the platform like a pizza shop, right? Like kind of like,
Yeah.
oh, you like, you just build it in one market, right? And then you just
Yeah.
make sure your expenses are less than the money you bring in, right? You kind of grow that way. But because so many doctors from all over the US joined, we just had all these, it's like, oh, I have to get, drive consumers for all of these. And it got to be expensive really fast with that scale. We bit off a little bit more than we can chew. So funding's always been, difficult for us. And it's been bittersweet because although it has constricted our ability to achieve sustainable revenue and scale, we have done amazing things on small budgets. And we really learned to consider every single dollar that we spend. And we really only invest money in the strategies and initiatives that will move the needle of growth for us. Business can only grow at its tightest constraint. And for UberDoc, that was always cash flow. So we really found some creative ways to work with that constraint.
Nice. No, it's it's case the adage of not move fast and break things. I'm not saying anything should be broken, but it's just a case of a sort of a. I mean, in Ireland, we say, making hay while the sun's shining. If people are coming in, you're not going to
Sure.
say no to the business. So with that being said, then obviously the monetization method really primarily comes from the consumers or the patients.
Yep.
And what does that look like in terms of getting these consumers to sign up?
Sure. And that's still something we're figuring out. But we, when we first launched UberDoc, like I said earlier, we really went all in on direct to consumer. And still, we have patients who use UberDoc every day who come through direct to consumer channels. With that, there's a lot of just brand awareness, consumer education, right? And then just being in the right place at the right time, right? So someone's going to use UberDoc when they need to see an orthopedic, right? Or make an appointment with the primary care physician. So we had to get really creative and digital strategies, right? So when someone's looking for orthopedic near me, UberDoc pops up as an option. So we were able to get pretty creative that way. But then we, in order to really scale this, right? So we got patients, we were seeing thousands of patients doing that. But then we realized, in order to really scale this, right, 10x scale this, we're going to have to make partnerships. So we made partnerships with a lot of employers in the areas where we had a high density of doctors. So employer in the US, one of the biggest costs for an employer is health insurance, providing health insurance for their employees. It's usually the second highest cost under payroll. And a lot of employers had self-funded health plans, which means, they pay, their employers, their employees' healthcare costs. So we decided that, UberDoc is a great option for them because one, it provides, it provides their employees quicker access, right, to doctors, which makes your employee happier. But it also is cheaper, right? So same thing with the patient, how they love to use UberDoc because they know what the cost is, and it's usually a little bit less than if they used insurance. Employer feels the exact same way, right? If they're paying the cost, they want their employees to use UberDoc because they know what it is, they can expect it. And it's a little bit less than if they used insurance. So we made lots of partners with or partnerships with employers, which has been great. But most recently, I would say, which was a pivotal moment for our company, is within the past year, we have partnered with local or state and federal agencies to facilitate military entrance exams as well as disability exams and VA exams. So, and that makes us we're really proud of this work, right? That we're able to serve, our nation's heroes as well as those who, need to maintain their disability benefits. With this partnership, we're able to get them their annual exams and provide them access to physicians.
I love that. On the topic then, on the topic of partnerships, there's one or two podcast guests, previous podcast guests. I think you get along great in terms of partnerships. So I'll definitely make sure to introduce you to them after. That I think you'd really hit it off with them, but I'll save that for a separate conversation. But on the topic then of getting those partnerships, are there any tips or tricks that you would have for another, healthcare entrepreneur, not necessarily clinic owner, but, a business such as yourself, an organization really, what tips have you learned along the way when it comes to forming great partnerships with adjacent businesses?
Yeah. I say this all the time to colleagues, and other entrepreneurs that I mentor is forming strategic partnerships is going to be the most important thing for your business. Just, when it comes to just expanding services too, UberDoc right now, is we connect patients to doctors for a consult, right? Or an appointment. But there are so many other healthcare services that happen out there, right? There's imaging, and there's, surgery, and there's prescriptions and things like that. And UberDoc doesn't really service those things, right? We just make the appointment. And as a startup who has like competing priorities, right, has capacity, issues and constraints when it comes to funding, our consumers were coming to us and saying, hey, like, it's great, I got in, to a doctor, but like, what other healthcare services can I access through UberDoc that I can pay cash for, right? Because it's going to be cheaper and quicker for me. And we spent a lot of time being like, oh, how can we bundle services, or how can we offer all these different all these different services within healthcare? And then we realized it's not in our wheelhouse, right? That's
Yeah.
just not what we are. So what we did is we partnered with other people who had that in their wheelhouse. So we partnered with a cash pay prescription company, right, that offers mail order prescriptions for cash. So, our doctors are able to, or our patients are able to see a doctor through UberDoc, and then the doctor can order the prescription through our partner. We did the exact same thing with imaging. We partnered with a wonderful radiologist who has a bunch of radiology clinics, who does cash pay imaging. So I think it's really important I think as an entrepreneur, like, you want to do all the things, right? You want to offer all the services and then figure out how you can do that. But like, don't do the things that aren't in your wheelhouse. It's really important to focus on like what is, what you're an expert on and what you've built, and then leverage other people for those other services and to scale.
Yeah. I would definitely test and agree with that. I mean, obviously, with our own agency, we do digital marketing, automations, and so on for clinics. And as we always say, as I say with any business, there's four levers we can pull to grow it. It's traffic and conversion and the price and the churn, or the lifetime value of your customers, patients, what have you. And as a marketing agency and automation agency, we can take care of a few of those things. We can get more traffic, similar to yourself, just different channel.
Yeah.
Improve the traffic, improve the conversion, and ideally improve the lifetime value by, having our own. We have our own strategies in terms of keeping people engaged, but we're not a jack of all trades. And
Yeah.
it's, there's so many pieces to the jigsaw. And as you said, it's best to stick with what you know and realize, okay, what other services or tools would do my avatar actually need? And that's where
Yeah.
you find the complementary in partnerships. I completely agree with
Yeah.
what you're saying there. In terms of actually finding these partners, do you do it through, do you reach out to them on LinkedIn, or, how does that actually look in terms of actionable steps?
Yeah, no, absolutely. I mean, a lot of the partners that we've met have actually been at like industry conferences, right? It's been like, just networking through other entrepreneurs, right? I do a lot of stuff here in the Boston startup ecosystem. And so I meet partners that way. Again, industry conferences are a great place to not only like, for instance, like for us, sell our services to physicians, but to meet other people who, are coming up with a really innovative digital healthcare platforms. There's so much stuff out there right now, specifically in healthcare. It's been awesome to meet people and connect with them.
Again, I love. I think you're only one or two joint ventures away from a multiple seven figure or eight figure, whatever scale you want, business. And I think everything in life, I always say, the cheesy part of me says, everything in life boils down to the quality of your relationships, both with yourself on a personal level and with others. And yeah, we could go deep about that, but I love that sort of relationship centric approach that you've been doing. And then with regards, I suppose, the future. I mean, we've talked about the past, how you got to where you're at today, what you're doing today. Uh, the future. Are there any trends in healthcare technology that are particularly exciting for you, as pertains to UberDoc?
Yeah. No, definitely. We always think about this all the time, right? Like, where's the industry going in the next like 5 to 10 years? And like where UberDoc is going to be in that. And I think the healthcare industry is moving towards more personalized, patient-centered care, with technology playing a pivotal role. and specifically, in the next 5 to 10 years. Um, I think we'll see an expansion in telehealth. I think that's becoming more and more used, and people are trying to really understand, the utility of that. And I think it's also more cost effective too, to connect
Mm.
with someone if you can via telehealth, right? Versus going into the office. I just think, as I live here in Boston, I just think what I save on parking costs alone, accessing a doctor over telehealth
Yeah.
versus going in. I think also AI driven diagnostics, right? There's lots of stuff out there right now with AI. I think people are trying to figure out how they can plug AI into different things because it's kind of a buzzword. But I do think that that's going to play a bigger role once people, figure out how to use it. And also data integration to provide more proactive and preventative care. But at UberDoc, we're staying ahead, by leveraging technology to make access even easier and to grow our partnership. So we're very excited to, I know we talked a lot about partnerships, but we're still excited to partner with new companies and figure out how we can work together, just to provide better access.
Again, I think everything that you're saying there, it's fairly aligned with my own predictions. I mean, I can see a world where doctors don't have their own AI co-pilot in the upcoming years when it comes to diagnostics. So at the end of the day, we balance each other out. You know, people get tired. We're people, but to
Yeah.
have someone, to work alongside you, to augment the process, give you more data points. I definitely think that that's the way things are going, and it's a purely net positive for everyone because it means more people can be helped and more accurately. And I think as a whole, a lot of people are I know you work with a lot of, say, for example, regenerative medicine clinics and so on. I do think that more holistic sort of proactive approach to healthcare is really the trend that seems to be the case with a lot of people uh, that we talk to on the podcast. Uh,
Yeah.
this being said, I'm gonna quote a bit of stoicism here. The only constant is change. The only thing that's guaranteed is for things to change. But that
Yeah.
that can be scary. That can be scary for people. If they're not used to it. There's you know if you're a physician 20 years ago and someone said, hey, you're going to be doing taking appointments over calls on a computer,
Yeah.
that's like, you're out of your mind. Uh,
No, absolutely. Yeah. And I bet. And also like direct pay healthcare too, right? I mean, I'm
yeah,
obviously biased towards direct pay healthcare, considering that's what we do. But I think more doctors, direct primary care, you brought that up earlier. It's kind of been there, right? A
mm,
lots of primary care doctors are kind of shifting towards that. And I now think even, a lot of other doctors, the specialists, right? The surgeons, the psychiatrists, they're also figuring out how to be part of the direct pay healthcare movement. And, it's funny when we initially launched UberDoc and we said to our doctors, like, hey, you're going to set your price. They were like, I have no idea what the price of a consult is. Nobody knew. They were like, can you
mm,
tell me what the price is? They're like, it just depends on insurance, right? Insurance pays a different amount. I've absolutely, they've never negotiated prices before. So now it's interesting to see them become a lot more comfortable and really understand, like, no, this is what the cost of my service is. Because it's important. You should know that. So that's been great to see too.
yeah, no, 100%. And for clinics or healthcare professionals that you believe need to adapt, adapt with the times. In your opinion, what are the best ways for clinics and healthcare professionals to prepare to adapt for the future that you envision?
I think I think keeping in aligned with industry trends, right? We actually we're partnered with this awesome organization called Innovator MD, founded by some physicians based out in Silicon Valley. And they what they do is they hold these yearly conferences where they just bring as many healthcare providers as they can together to just talk about innovation, right? To talk about like what are the new things out there, what are the new trends, what are the new companies, right? And it's just amazing to see doctors come up with different ideas and new innovation and different platforms and things like that. So I think like being part of those communities is really important, right? It's been awesome for UberDoc because I feel like we always knew, like we always kind of saw like the new stuff coming out before it came out. So I think that's really important. And I think also just listening to the patient. I think that's like literally the most important thing you can do. There's a lot of noise out there. Doctors spend, I don't know what it is. I think I saw a statistic where they spend like 6 hours a day on administrative tasks, which is
Okay.
not, it's insane. It's like, and that's just on documenting, like submitting things to insurance, right? Not on direct patient care. So not sitting in front of a patient, just literally doing administrative tasks. And imagine medicine if like all of that time was spent just like connecting with patients and listening to them and and empowering one another. So I think that's what we love about UberDoc again, is that like with that, with UberDoc, the goal is like, because there's no administrative, burden with any of this, you get to spend more time with your patient.
It's incredible. And on a personal level, then, as I said, you as was the leader within the business, along with your business partner, I know from personal experience running business, it's stressful. It's not easy at times. There's ups, there's downs. That's it is really a journey of personal growth, as well as obviously helping more people help more people, as I like to say about our agency. But
Yeah.
how do you find, just again on a personal level, managing the constant changes, when running your business, what keeps you motivated and inspired as a leader within the business? I suppose that'd be my first question.
Sure. Probably my team. I have an incredible team around me at UberDoc. People who have just like been really inspired by our mission. And we've been doing this for almost a decade now. We've had, lots of people who have come and gone, especially in startups. You see, people come at the beginning of their career and then go off and do bigger and greater things, which is exactly what you want to do what you want as a leader, right? Is you want them to go off and do bigger and greater things. So it's been really awesome, to have our team. We've had amazing interns, really awesome. We're here in Boston, which has some of the most incredible talent, right? Some of the greatest schools. We've had awesome interns who have been part of this journey with us. So the team keeps me motivated 100%. And I think you brought this up earlier, but the biggest lesson I've learned in my journey is that there are very few constants when it comes to entrepreneurship. From emotions to partnerships and even team members, things are constantly changing. And you have to be flexible and adaptable. There's a lot of value in having the ability to switch gears quickly and not letting the tough times discourage your process, but also not letting the successes go to your head too. I think that's, really important as well. You brought up earlier about like moving fast and breaking things. And I kind of have that concept, I believe in that too, right? It's taken me a while, but something I'm not afraid of anymore is failure. I used to be so afraid of failure, like so much that I wouldn't like move. I was so afraid to make a movement because I was like, oh my God, I'm going to make a mistake. But then I realized, oh my gosh, I'm just holding myself back, right? We
Mm.
can get over any mistake or failure, but like, if you don't move, if you're paralyzed and you're just not moving, that's the worst thing you can do in a business, especially a startup. So surround yourself with really great people, because they'll keep you motivated, and people who are smarter than you too. That's
Yeah.
very important. Always surround yourself with people who are way smarter than you, and that'll keep you going.
I love that. And then when it comes to, suppose, skills, I heard a good quote before about business. It's there's no one magic bullet. It's a million silver
Yeah.
BBs. You're stacking up different skills, different bits,
Yep.
processes here and there. On the topic of the skills side of things, what do you believe today is the most important skill that you've managed to develop over the past few years that are, yeah, what's the main skill you think is serving you these days?
Yeah, that's a good question. Yeah, and it's kind of like the sum of the parts,
Yeah,
like the
exactly.
sum of the
Yeah.
parts is greater than the whole. I think and I think this can be said for, any entrepreneur in any industry and things like that. I think it's, one, just like what we just talked about, being able, not being unwilling to make a mistake, right? Kind of realizing like that's just part of the course and like we do it, we fix it, we move on and we learn from it. I think, one of the things I always try to remember, and I say to my team too, is like, I'm okay with any mistake made. Like, it's okay, right? But let's just not make it again, right? Like, let's make a mistake once, learn from it, and then no, and then just not repeat that same thing, right? But let's not be afraid to mess up. So I think that's one thing. I think the other thing too is like, just being able to connect with people, I think is really important. I think in any part of your life, but specifically, in entrepreneurship, whether you're, recruiting new team members or, forming strategic partnerships or pitching to investors, right? People just want to connect and they just want to work with people they feel like they could work with on a daily basis, right? And a lot of skills can be learned, right? We think that's kind of our mentality when we bring on new members to the UberDoc team. It's less to do with like, what, your tangible skills or the things you learned at your last company, right? Like I can teach you how to use our CRM, right? Anybody can teach you how to do it. But at the end of the day, like, could you get in front of our investors, right? Do I feel like we could have a collaborative like team environment? And I think that's the most important thing. It's really like that human and people skill.
Uh, Again, I agree 100% with that. It's a lesson. I don't know about you, but I think every business owner at some point, it's easy to become impressed by the resume or the LinkedIn
Mhm.
profile, and I call it the airport test. Basically, it's basically when I'm making a new hire, it's would I mind being stuck in an airport with this person for
Sure. Oh, I like that.
if not, it's not
Yeah.
going to work. That's like the litmus
Yeah.
test we think of. But you know, again, you could apply this to any relationship in life. And again, circling back, everything boils down to the quality of our relationships. Uh,
Yeah.
I believe these are principles that are universal, be it business, familial, platonic, romantic, what have you. And uh, okay, maybe not romantic in where I'm going with this, but I think that the things, okay, definitely not in this case, but within the business side of things, there's three things I think that are important. And that's really competence, so skill set. Yeah, that's right. Energy, basically, how hard is the work ethic, and what I believe is the most important, which is what we're agreeing on here, is the integrity side of things. So competence,
Sure.
energy, and integrity. Because if someone's not great at what they do, but they work really hard, they'll get there eventually. If someone's really smart, they don't work, you're not going to get anything done.
Yeah.
But I think of it as like that's like the force multiplier. I studied biomedical engineering, so I think of this variable. I'm literally thinking of vectors here. But point being is, you could have someone who's really good at what they do, really hard worker. But if they're not heading in the same direction as you, it actually causes more headache than if they
Sure.
weren't good at what they did, because they're just running in the opposite direction. You're trying to catch up, get them back in
Yeah.
course. And uh, yeah, as time has gone on for me, I think team culture is quite literally the most important factor.
Yeah.
Hard skills can be learned. In
Yeah.
my personal
Absolutely
experience.
agree.
Yeah, no, it's a lesson. It's an expensive lesson, but it's an important one
Yeah.
to to learn. In terms of managing the time, you've got so much of a broad scope for your role, and I'd love to hear. How do you personally manage your time when it comes to getting the most out of your own routine? Do you have any cliche question on podcasts these days? Morning routines. Do you plan the day ahead? Do you plan the week? What does that actual planning process look like for you?
Sure. I wish I had the perfect answer for this. I'm still figuring that out. Like
Yeah.
it's hard. It's really hard because it's not just, work, right work, but like we have personal lives too, right? And it's
Yeah.
like how do you manage all these like orbits of things going on? And it's something I work on every day. I haven't, found the silver bullet for it, but something I do is I write. I'm still a pen and paper person. I write everything with pen and paper. It really helps me when I'm like writing things out. It really helps me like think through it and prioritize it. I do a to-do list every single day. So every single day I write myself a to-do list. They used to be really long and extensive because, I had, I was had very high expectations, and I thought like, oh my gosh, I'm going to do all these things. But then I realized you can't accomplish 20 things in a day. So I usually do about four. My to-do list is four things, and it's the things that have to be done today. Like they just have to, right? And if they're, and tomorrow will be things that like, have to be done tomorrow. And anything that doesn't get done, it's the first on the list, tomorrow morning. But I think that's helped me hold myself accountable, which is something, I think we all struggle with sometimes, is just holding ourselves accountable. So a to-do list is really important. And also merging I used to have two to-do lists. It used to be like my professional, like my work to-do list, and then my home to-do list, right? It's like, oh, I've got to do laundry tonight or whatever. I've merged those two things together. So it's like you have one to-do list. And making sure that one of those items on your to-do list is a self-care item. It's really right. You never think, nobody prioritize. It's really hard to prioritize self-care. And I realized I can do that when it's on my to-do list. Because I think another thing I chase too is I love like crossing things out, right? I love that feeling of like doing something, crossing it out. Having a self-care item on there is important.
Right. But to clarify for anyone listening, when you say merging to-do lists, it's not a case where you're doing the laundry as you're in a meeting or
Not always. Not always. I've only gotten away with that one.
Camera's not working today.
We've all done that trick.
Yeah, at some point. Okay, last question for you is, what's the lasting impact that you want UberDoc to have? It's 10, 20, 30, 40, whatever amount of years. What is, actually, two questions. What is the impact you'd like UberDoc to have? What is the impact that you personally would like to have in-house?
Yeah, no, I like both those. So at least, from UberDoc standpoint, we, I mentioned this earlier about our mission being to democratize access to healthcare, right? That's always our mission and vision. We stay true to that. We make sure we revisit that on a weekly basis to know that the things that we're doing and the initiatives that we're working on reinforce that mission and vision. 40 years from now, I hope that, there are lots of doctors and patients out there who could say, you know what, I used UberDoc and it helped me get access to a doctor. I understand that people aren't going to use UberDoc every single time they need to access the healthcare system, but we want to be a safety net for folks, right? I want everyone to know that this is an option for you. If you choose, it's the best option for you. And it's kind of that sense of empowerment that we, as a company, we want to leave behind as a legacy. And also restoring the doctor-patient relationship. We talked about this a little bit, but like there are two stakeholders in healthcare that matter the most, and they are doctors and they are patients. And we want to make sure that we are connecting those two and empowering both of those. And kind of on the theme of empowerment, similarly to my own journey, right? I hope to, empower other entrepreneurs to kind of go out, take risks, and do the things that they're super passionate about. I'm a passionate advocate for diversity in entrepreneurship diversity and inclusion in entrepreneurship. As I mentioned this before, but as a female founder and a first-time founder, I had no idea what I'm doing. I still literally have no idea what I'm doing. But it's the idea that like you have people on your side, right? Like other people who can who are a couple of steps ahead of you down the path, who can say, hey, you know what? Like this is, my experience and maybe this can help you too. I think like I love to get to know other entrepreneurs and I really enjoy building communities where we can all support each other, because entrepreneurship can feel very isolated at times, right? There are so many times where I just felt like I was like alone on an island trying to figure out like how to keep this company alive and prioritize myself and avoid burnout, right? So I think like being able to connect with other entrepreneurs and founders is just really important. And I hope to keep doing that more.
Oh, great answers. That being said, Brianna, I've really, really enjoyed this. I think it's sincerely from the bottom of my heart. I think it's a very legitimately inspiring mission that you're on. I think it's an absolute no-brainer. Anyone listening, again, Brianna's not asked. I've no skin in the game here. She's not asked me to say this. check out UberDoc. I think there's no downside to it, and spread the word. So with that being said, Brianna, again, thank you so much. Where can people find out more about you and what you do?
Yep. So you can visit our website, which is uber-docs.com. Please feel free to reach out to me directly on LinkedIn. And my email is brianna@uber-docs.com.
Brianna, thanks so much. It's been great.
Awesome. Thank you for having me.